Welcome to my research presentation entitled Retrospective Analysis of a Buprenorphine and Ketamine Dual Prescription Patient Cohort. My name is Hailey Briseno, a medical student at University of Washington. I want to take a moment to say thank you to my research mentor, Dr. Lucinda Grande, who has provided so much in terms of support and guidance for this project. First, I would like to provide some context into the nature of the research problem. The first aspect I would like to address is the increasing need for mental health treatment in primary care. 90% of Americans believe the United States is facing a mental health crisis. Rates of anxiety, depression, and suicide have increased dramatically, placing strain on existing mental health treatment services to include primary care. The second aspect I would like to address is the nature and impact of opioid use disorder in the U.S. Opioids were involved in more than 68,000 deaths in 2020. Subsequent research data suggests only 22% of those with opioid use disorder received treatment in 2021. The third aspect I would like to address is the prevalence of acute and chronic pain conditions in conjunction with opioid use disorder, a phenomenon described by the NIH as a double crisis. Research suggests 40 to 60% of individuals with an opioid use disorder also have chronic pain. Clinical indications. Buprenorphine is considered a safe medication for the treatment of opioid use disorder and chronic pain with very low risk of respiratory depression and overdose. Ketamine, an FDA-approved anesthetic, is increasingly being used in the treatment of depression and pain, with additional benefits appreciated in relief of opioid withdrawal symptoms. The purpose of this study is to characterize the use of buprenorphine and ketamine dual prescription in a primary care patient cohort with co-occurring disorders and assess the observed changes in prescription opioid use and associated risk. Methods. This project is a retrospective analysis of a primary care patient cohort wherein patients were selected based on dual prescription of both buprenorphine and ketamine in the year 2022. Prescriptions were characterized by primary indication, mental health, opioid use disorder, and acute or chronic pain, and treatment duration. Opioid use status was defined at time of first prescription, either buprenorphine or ketamine, and again at study end. Results. 45 patients were identified as having met selection criteria. Of these, there were 26 females and 19 males, with ages ranging from 32 to 83 with an average age of 56. Primary indications for the prescription of buprenorphine included opioid use disorder at 62%, chronic pain at 36%, and mental health at 2%. The average duration of treatment was 5.3 years. Primary indications for the prescription of ketamine included chronic pain at 60%, mental health at 24%, acute pain at 7%, and opioid withdrawal at 9%. The average duration of treatment was 5.1 years. In terms of initial opioid status, 44% of patients had an initial status of prescription opioids, 20% buprenorphine, 18% no opioids, 16% illicit opioids, and 2% methadone. Our study found that of the 20 patients with initial status of prescription opioids, 55% discontinued opioids completely by end of study. Of the remaining patients with initial status of prescription opioids, the dose was lower in 44%, unchanged in 33%, and higher in 22%, with 78% of these patients being co-prescribed buprenorphine. Conclusion. Our study demonstrated that dual prescription of buprenorphine and ketamine in primary care is a viable strategy for long-term management of co-occurring mental health, opioid use, and chronic pain disorders while mitigating risks associated with chronic opioid use, such as problematic behaviors, hyperalgesia, and overdose. This is evidenced by the extended duration of treatment in this group of patients and the marked reduction in prescription opioid use in the subgroup with initial status of prescription opioids. These tenets hold true across several different prescription indications, largely classified as mental health, opioid use, or pain disorders. In addition, we have identified avenues for further exploration within this research area, and I have included some of them here. Thank you for your time and attention. It has been my pleasure to share this important research with you, especially as it relates to the increasing prevalence of these co-occurring disorders and the challenges they present in primary care.